Nationally, the steady decline in COVID-19 disease activity continues. The latest 7-day average is now below 2,700 cases reported daily, which is a 70% decrease from the peak of the third wave, with a considerable decline in infection rates. The number of people experiencing severe and critical illness has also declined. The latest 7-day average for the number of COVID-19 being treated in our hospitals each day has dropped 40% since the peak to about 2,600 daily. Of these, on average, under 1,100 were being treated in intensive care units, down 25% since the peak, and average daily deaths are now also down 25% to 39 deaths being reported daily. Although the long months of this pandemic have been difficult, Canadians have worked together to get through the hardest parts, overcome the challenges of the many uncertainties we've encountered, and stepped up to do their part at every turn. This is perhaps no more evident than now, with vaccine uptake increasing in leaps and bounds as supplies have increased and rollout expands. At the same time, Canada's dedicated and diverse health and research professionals have continued to monitor vaccine safety, evaluate effectiveness, and assess the latest evidence on COVID-19 vaccines and vaccination programs in Canada and worldwide. As part of this real-time monitoring and expert review of the latest scientific evidence, Canada's National Advisory Committee on Immunization, or NACI, has worked to quickly adapt its guidance on the use of COVID-19 vaccines in Canada to ensure optimal protection of Canadians at pace with the ever-changing circumstances during this pandemic. As always, NACI recommendations are based on the strength of emerging evidence over top of a strong foundation from many decades of experience with vaccine programs in Canada. NACI's latest guidance, released today, considered a range of factors from safety concerns through vaccine supply to provide recommendations on the safety and effectiveness of the interchangeability of authorized COVID-19 vaccines or mixed vaccine schedules for first and second doses of COVID-19 vaccines. This advice provides provinces and territories with safe and effective options to manage their vaccine programs, specifically advising that people who received a first dose of AstraZeneca-Oxford vaccine may receive either AstraZeneca-Oxford vaccine or an mRNA, so Pfizer-BioNTech or Moderna vaccine for their second dose, unless contraindicated. People who received a first dose of an mRNA vaccine, so that's Pfizer-BioNTech or Moderna, vaccine should be offered the same mRNA vaccine for their second dose. But if the same mRNA vaccine is not readily available or unknown, another mRNA vaccine can be considered interchangeable and should be offered to complete the vaccine series. In short, the interchangeability of vaccines means that you can receive one vaccine product for your first dose and safely receive a different vaccine for your second dose to complete your 2-dose vaccine series for optimal protection from COVID-19. While NACI continues to recommend that jurisdictions maximize the number of individuals benefiting from the first dose of COVID-19 vaccine by extending the interval between doses up to 4 months, in the context of increasing COVID-19 vaccine supply in Canada, the committee recommended last week that second doses be offered as soon as possible. NACI recommends that priority for second doses should be given to those at highest risk of severe illness and death from COVID-19 disease, after or at the same time as first doses are offered to all remaining eligible populations. NACI continues to closely monitor the effectiveness of extending those intervals and will update recommendations as needed. Canada's regulatory, public health, medical and research professionals remain dedicated to working together to closely monitor vaccine safety and effectiveness while rapidly responding to new evidence to maintain optimal use of vaccines in Canada. As the science and situation evolves, we are committed to providing clear and evidence-informed guidance in order to keep everyone in Canada safe and healthy. Thank you.
Bonjour à toutes et à tous. À l'échelle nationale, nous continuons d'enregistrer une baisse constante de la transmission de la COVID-19. En ce qui concerne le nombre de cas signalés quotidiennement, la dernière moyenne sur 7 jours est maintenant passée en deçà de 2700 cas signalés par jour, ce qui représente une diminution de
cases per day, which represents a 70% drop from the height of the third wave. The number of people suffering from sickness is also dropping. The number of people hospitalized has dropped by 40% for approximately 2,600 people per day.
100 people were being treated in intensive care units, down 25% since the peak, and the average daily deaths are also down 25% to 39 deaths being reported daily. Although the long months of this pandemic have been difficult, Canadians have worked together to get through the hardest parts, overcome the challenges of the many uncertainties we've encountered, and stepped up to do their part at every turn. This is perhaps no more evident than now, with vaccine uptake increasing in leaps and bounds as supplies have increased and rollout expands. At the same time, Canada's dedicated and diverse health and research professionals have continued to monitor vaccine safety, evaluate effectiveness, and assess the latest evidence on COVID-19 vaccines and vaccination programs in Canada and worldwide. As part of this real-time monitoring and expert review of the latest scientific evidence, Canada's National Advisory Committee on Immunization, NACI, has worked to quickly adapt its guidance on the use of COVID-19 vaccines in Canada to ensure optimal protection of Canadians at pace with the ever-changing circumstances during this pandemic. As always, NACI recommendations are based on the strength of emerging evidence over top of a strong foundation from many decades of experience with vaccine programs in Canada. NACI's latest guidance, released today, considered a range of factors, from safety concerns through vaccine supply, to provide recommendations on the safety and effectiveness of the interchangeability of authorized COVID-19 vaccines or mixed vaccine schedules for first and second doses of COVID-19 vaccines. This advice provides provinces and territories with safe and effective options to manage their vaccine programs, specifically advising that people who received a first dose of the AstraZeneca-Covishield vaccine may receive either AstraZeneca-Covishield vaccine or an mRNA, Pfizer-BioNTech, or Moderna for their second dose, unless contraindicated. People who received a first dose of an mRNA, Pfizer-BioNTech, or Moderna vaccine should be offered the same mRNA vaccine for their second dose, but if the same mRNA vaccine is not readily available or unknown, another mRNA vaccine can be considered interchangeable and should be offered to complete the vaccine series. In short, the interchangeability of vaccines means you can receive one vaccine product for your first dose and safely receive a different vaccine for your second dose to complete your two-dose vaccine series for optimal protection from COVID-19. While NACI continues to recommend that jurisdictions maximize the number of individuals benefiting from the first dose of a COVID-19 vaccine by extending the interval between doses up to 4 months, in the context of increasing COVID-19 vaccine supply in Canada, the committee recommended last week that second doses be offered as soon as possible. NACI recommends that priority for second doses should be given to those at highest risk of severe illness and death from COVID-19 disease after or at the same time as first doses are offered to all remaining eligible populations. NACI continues to closely monitor the effectiveness of extending dose intervals and will update recommendations as needed. Canada's regulatory, public health, medical, and research professionals remain dedicated to working together to closely monitor vaccine safety and effectiveness while rapidly responding to new evidence to maintain optimal use of vaccines in Canada. As the science and situation evolves, we are committed to providing clear and evidence-informed guidance in order to keep everyone in Canada safe and healthy. Thank you.
Merci, Dr. Tam and Dr. New. Thank you.
Thank you.
We will now open the phone line to questions. We ask that you limit yourself to one question and one follow-up. We will be taking your questions in both official languages.
We will take questions and ask you to limit yourselves to one question and one follow-up. You can ask your question in either official language.
Thank you. Merci. Please press star 1 if you have a question. Veuillez appuyer sur étoile 1 pour poser une question. Our first question is from Marika Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Good afternoon. Thanks for taking our questions. Dr. Tam, can you please give a bit more explanation of the efficacy or the immune response from mixing the doses? So if a person got AstraZeneca followed by Pfizer, is their immune response equal to having 2 Pfizer shots, or how do we know that this still gives them sufficient coverage or protection, I should say?
Thank you for that question. First of all, I just want to say that this isn't a new concept. So having multi-dose series in terms of vaccines given by different manufacturers is something that public health have used over time for many other vaccines. So whether it's your flu shots or hepatitis A, or there are many others where over time and when vaccine programs and supplies change, this is not an unusual thing to do. So NACI, in formulating the recommendation, looked at a series of recent studies. So first of all is safety. We'll get to the immune response in a minute, but there's recent studies on safety and one study on the immune response. So there were studies from Germany, from the United Kingdom, as well as from a Spanish trial, reporting that this combination or this mixed schedule of AstraZeneca, followed by Pfizer, for example, is safe, has a good safety profile over a series of different kinds of intervals, 4 weeks, 8 to 12 weeks, for example. And but there is a possibility of increased short-term side effects when using this mixed schedule, such as headaches, fatigue, feeling generally ill, but they are temporary and without complications. And so then if you looked at the actual immune response, the study from the Spanish trial showed that if you measure antibody response in someone who got that second dose, who got AstraZeneca and then had the second dose as Pfizer, they mounted a really robust immune response. So that boosting response that you want to see is very much present. So that's the study in particular that NACI has taken into account. But we do know that there are ongoing studies that we'll be monitoring over the coming weeks and months as well. But that is a very good initial and early sign that this combination has a really robust immune boosting effect.
Follow-up?
Thank you for that. I'm wondering, given what you're saying about the fact that we do have evidence of a robust immune response, why then we still are using AstraZeneca at all? Why is this only a discretionary recommendation and not simply saying, you know, we have the data that shows that mRNA vaccines are sufficient for mixing, so why are we still using AstraZeneca at all, and why? Like, can you explain that?
Yeah, that's a really good question. Of course, this is just mounting data. This is some of the data that we have at the start, and I think NACI deemed that they're sufficient for the recommendation. I think at this point, there are individuals who prefer to get that second dose as the same vaccine series. That's because, of course, the baseline manufacturing indication is to use two vaccines on the same dose. And so that option has been retained. But as individuals who are making their choice to get that second dose, should look at, of course, all the information in front of them about AstraZeneca, for example. That second dose, what we've seen, of course, one of the elements that NACI took into account when they made a recommendation that is a safety profile and the rare but serious occurrence of this thrombosis and low platelets events after AstraZeneca. What they found at this moment in time, that's not to say this wouldn't change, that the rate of this thrombotic event after the second dose seemed to be lower than after the first dose, but this could increase over time. And I think people need to know that kind of information. Right now, it's 1 in 600,000 people who got that second dose as having that thrombosis event, but that could change. This also needs to be taken into account as people balance the risks and benefits against the epidemiology that's in their local setting as well. But I think it is good news that people now have the choice.